morning. Today our research group will be discussing the current surgical skin preparation for cesarean sections. We will be comparing chlorhexidine versus iodine. Our group members include Stephanie Simpson, Shelby Tieken, Emily Wright, and I am Caroline Walker. Currently, there is no standard practice for surgical skin preparation for women undergoing cesarean sections. In rural hospitals, protocol dictates only that some sort of skin preparation must be used. It does not designate which kind. The peacock question that we have concocted is, will using chlorhexidine gluconate for skin preparation have a lower infection rate when compared using iodine for skin preparation on women undergoing cesarean sections? To break down our PICO question, the P, which represents population, is pregnant women undergoing cesarean sections in the rural hospital setting. I represents our intervention, which is using chlorhexidine gluconate for skin preparation. C is our comparison, which is iodine. O represents our outcome, which will eliminate or reduce cultures at the incision site with zero side effects of infection. And T represents our timing, which is the pre-op skin preparation period, which is our intervention being applied.
Durucci et al. Examined the difference between preoperative cleansing with chlorhexidine and iodine in the reduction of surgical site infections in patients undergoing surgery. The participants were randomly assigned in two different groups. One group which they used chlorhexidine and the other they used iodine. The rate of surgical site infection was significantly lower in the chlorhexidine group. Researchers suggest an advantage of chlorhexidine may be its superior protection due to its rapid action, persistent activity despite bodily fluid exposure, and residual effect. Rock measured the effectiveness of recommended care initiative outlined to reduce rates of surgical site infections in women undergoing cesarean sections. Examined the data about patients who received C-section after implementation of the protocol. He found that incisional infection rates decreased to zero immediately after the initiation of chlorhexidine. Furthermore, there was a reduction of 99.9% of bacterial counts within 3 minutes of exposure to chlorhexidine, leading to a reduction in infection. There is also an additional cost benefit with the reduction of surgical site infections. Variables may have an effect on the results as multiple interventions were involved in skin preparation, such as chlorhexidine no-rinse cloths.
According to Edwards, Lip, and Holmes, who conducted a systematic review of 7 studies examining the difference between a variety of antiseptics to prevent surgical wound infection postoperatively, one sought to examine potential differences in the reduction of surgical site infections between chlorhexidine and iodine. Significantly, more patients in the iodine group developed a surgical site infection than those assigned to the chlorhexidine group. Another study demonstrated a significant difference in the incidence of surgical site infection in participants assigned to chlorhexidine group and assigned to the iodine group. Thus, individuals who were assigned to the iodine group had significantly higher rates of infection than those assigned to the chlorhexidine group. Additionally, patients who did not contract a surgical site infection spent approximately 5 to 6 days less in the hospital than those who contracted surgical site infections. Scowcroft conducted a literature review of 7 studies which examined efficacy of chlorhexidine, gluconate, and iodine in the prevention of surgical site infection. In this review, results differ with respect to the difference between chlorhexidine and iodine. One study determined that there were no significant differences between the two skin preparation solutions. However, the researchers suggested chlorhexidine is superior to iodine due to the residual antiseptic effects. Conversely, several additional studies demonstrated efficacy of chlorhexidine in reduction of infection when compared to iodine. Furthermore, researchers outlined that chlorhexidine has an immediate bactericidal action that exceeds iodine, as well as persistent activity despite exposure to bodily fluids such as blood and serum proteins.
Mangrum et al. Have provided us with clinical practice guidelines for the prevention of surgical site infections. While both chlorhexidine and iodine have a broad spectrum antimicrobial activity, Chlorhexidine appears to be superior in reducing the incidence of surgical site infections, as well as demonstrates a greater residual activity at the site. Additionally, research demonstrates that while iodine is inactivated by blood and serum proteins, chlorhexidine is not. Thus, it appears to be a better antiseptic agent. Upon completion of the review of the multitude of studies we've outlined, it appears as though chlorhexidine is a far superior agent in the reduction of surgical site infections. Furthermore, Edwards et al. Has outlined or demonstrated that individuals who do not receive a surgical site infection have a decreased length of hospital stay. While chlorhexidine may cost slightly more than iodine, the reduction in length of hospitalization results in a decreased cost of hospitalization. Thus, it appears as though there will be a greater cost benefit to utilizing chlorhexidine. Therefore, as a group, we believe that chlorhexidine should be used as an agent in preparing the surgical site infection for women undergoing cesarean sections. However, further research needs to be conducted to examine the efficacy of this agent, chlorhexidine, on women undergoing cesarean sections, as well as nurses in the OR suite learning to correctly apply chlorhexidine.